Thanks everyone for joining us today for another one of our famous cooperative leader conversations. We've received an incredibly positive response to these sessions, and where our senior leaders share their insights and knowledge. So these sessions are being recorded and shared with both our domestic and international audiences. And today I have the pleasure of welcoming Harley Aish, who is highly knowledgeable of the cooperative business model. Harley's currently chairman of ProCare, a major healthcare provider here in New Zealand, along with being a director of Medical Assurance Society, one of our largest insurance companies. ProCare has made it into this year's Cooperative Business Leaders Awards finalists, and so they're really leading the way in this area. So thank you, Harley, for joining us. Great to have you here.
Hello, Roz, and thank you for inviting me. It's great to be here.
So I've just got a few questions that we put together in terms of today's discussion, and you know, add anything that you'd like to. So I guess for people who don't know much about ProCare, it'd be really good to understand a bit about yourself and then how ProCare came into be.
Yeah, thank you. So I'm a general practitioner working in Altara in South Auckland, and I'm also chair of ProCare Networks Ltd. And as you've rightly informed everyone, I'm also the chair of Medical Assurance Society, which is a member-owned general insurance, life insurance and KiwiSaver provider. So just for your information, ProCare was started over 25 years ago as a service and contracting organisation between general practices and funders. And just for those who've got long memories, back then we had regional health authorities. Then we had a health reform, and we had district health boards. So we've moved from contracting with the RHAs to contracting with DHBs. And of course, next year we'll be working with Health New Zealand and Māori Health Authority with the latest health and disability review. So for the members who don't know much about ProCare, ProCare is the largest primary health organisation in Aotearoa, New Zealand, with approximately 160 general practice clinics in Auckland. We're still Auckland based at this stage, and about 800,000 patients enrolled with those clinics. So ProCare provides services to practices, and I just sort of went through a quick list of what we do, but it's not comprehensive. There'll be some things I've forgotten: business improvement, quality reports, collaboratives to improve the quality of health and practices, innovation, HR services to practices, that's recruitment of staff, helping them with any disputes or locums when somebody leaves suddenly. And we also have an exchange for buying and selling practices. We also do a lot about aggregating up data and presenting it to our funders and managing those contracts with our funders and their expectations and change management in the practices. ProCare also provides services direct to patients, such as quit smoking counselling, psychological therapy. We have three branches of psychologist services called Fresh Minds in 3 different parts of Auckland. We have dietitians in our staff and health coaches as well. And we have psychological therapists put in individual practices as well. So that's a bit of an overview of the breadth of work that ProCare does.
So it's very significant by the sounds of things in terms of the services offered to those GP practices. Yeah. So I guess you mentioned about the change in the health sector. So what's your vision for the cooperative? Because obviously that must make you question the co-op model and how that will fit with going forward to the changes.
Look, the co-op model, I think, is probably the, you know, with hindsight, it was the right thing for us to change to becoming a co-op. Before that, we were a limited liability company. You know, we occasionally paid dividends, and it just wasn't working for us. So we changed to a cooperative because that's what we were all about. We were always about benefits to our members and flow through benefits to our patients. So a cooperative was right when we set it up a couple of years ago, when we transformed into it. And now with the health reforms, I still think it's the right model because, you know, in health, there's a real among funders are quite well, you can't be making profit out of health. You know, this is government money. It's for patient health, you can't make profit. So a cooperative is not geared to make profit. It's about benefits to our members, and our members benefit our patients. So, you know, I think it works really well.
No, that's great. And it's interesting because you're the first in the health sector here in New Zealand is really, but internationally we see a lot of cooperatives in the health sector, very successful cooperatives. So it's great that you're paving the way. And I sort of get the sense that you might be expanding outside of Auckland at some time in the near future. So that's an interesting, you know, with the changes, it's probably quite timely. So just in terms of that, what are the key issues for the business that you're currently trying to address?
So maybe we can talk about COVID in a separate question, because that is very all-consuming. So I'll talk about some of the other issues that our organisation is is working with. So how do we make ourselves more relevant in a modern environment? So I think organisations all around New Zealand are thinking about obligations to our Māori stakeholders, and in our case, that's our Māori patients. Over 20% of our patients are Māori. What does that actually look like? How do we do that authentically? So first of all, we would say, well, from the top, let's lead from the top. And we're actively at the moment, you know, this week we've got some interviews to appoint a director who has a real strength and leadership in Te Ao Māori, the Māori worldview, and bringing that person onto our board. So that's a sort of change that we have right now, is getting diversity on our board and recognising our obligations, or our real moral obligations to honouring the treaty. So diversity is a real big one, and that's not just having a person on the board. It's about having a board culture that's is really curious and willing to change and self-examines about how we lead our organisation. And so it's not just having one person, it's about the whole board having that mindset. The second thing I would, and then that flows through to our organisation. So we're Auckland based, so of course our staff are very multicultural. How do you respect people's culture and make it a safe place to be different, and your views be expressed and valued, no matter where you come from, your upbringing, your socioeconomic background, your cultural, religious views. So those are the things that we find just modern challenges that I'm sure a lot of cooperatives are having. We've got another little thing which, you know, might be specific to our organisation, but there's a lot of corporates buying general practices at the moment. So we've supported the clinician-owned primary care services. So, you know, the typical thing is that the doctor owns the practice that they work in, and we think that's a great model. There's a real alignment. But then there's corporates out there, Green Cross, Tamaki Health, that are buying practices and have a different model. And there's different drivers when you have a return to shareholder. They're not doing anything illegal, but we think that the clinician-owned primary care service is a better model. So that's a key issue. How do we address that? We're really concerned about the differences in the health of our Māori patients. So, you know, looking past our members of our practices, but looking past them into the patients that are enrolled. And, you know, for example, you know, those who might be watching an international audience, in New Zealand, our Māori people live on average 7 years less than Pākehā. And then that gets worse by gender as well. So, and that's regardless of socioeconomic status. That's a real sobering thing to have. And so that's something which we find as a challenge, but something that we're working on. How do we address that? Yeah, there you go. There's a few things we're working on.
No, I think it's really interesting, because obviously there's a lot of countries globally who are really looking at how do they ensure they look after their Indigenous people. So great to hear the steps that you're taking within the organisation. And I'm also aware that you've recently brought on a new CEO with Bundy Norwell and a new CFO with Steve Webber, who haven't come from the co-op sector, and some of the challenges around bringing in people from other organisations and giving them the knowledge of the behaviours that you need from those people in terms of running a cooperative Do you feel that that's different?
Yes, I think there's different drivers at the executive level when you're in a cooperative. I think both Bindi and Steve, as our new CEO and new CFO, have really stepped into the space well and embraced the freedoms and the challenges that come with being a cooperative.
Yeah, no, I've been very impressed. So well done. So in terms of, we touched on COVID before, and obviously many of our members are having to address COVID. From ProCare, obviously you're an essential service and frontline workforce. Can you talk us through how ProCare's actually navigated the latest outbreak? Might be good in terms of sharing some of those learnings with the members.
Yes, so if we just go and talk about the practices first and how we've supported our practices, we've got regular updates on changes to guidelines and resources, and sometimes our team are doing daily emails with updates about different things. So that's good communication. As a co-op, we've had to advocate for the needs of the practices, like making sure there's enough personal protection equipment and making sure the supply chain is working. The first lockdown, we were even getting some video cameras and helping practices set up so they could do video consults. We've done a lot of work in the last 2 months supporting practices to become accredited to give the COVID vaccination, and that's been quite a bureaucratic process that the ministry have. So we've been supporting practices to step through and doing the evaluation and saying, yep, this practice is ready to go. Advice on keeping practice staff safe, managing potentially infectious patients. We've set up a web page for patients about COVID-19 resources. We've got this is one that we think is quite innovative, having a practice status reporting tool where the practice can give us, we can recognise when a practices are under strain, so that we can step in and support them when they're sort of gone from the green to the amber before they reach the red critical phase and unable to look after patients. So we've got that kind of monitoring over all 160 practices. And of course, instead of having practice leaders forums and face-to-face ways, we're running webinars to update our members on ongoing issues and for Q&A time. So that's the practices. For our ProCare staff workforce, I'm sure it's like a lot of cooperatives, we've pivoted staff to work from home with frequent Zoom or Microsoft Teams meetings. Practice support staff who would normally go and visit practices have been reaching out to practices to see what their needs are. We had a large number of staff who were seeing patients face-to-face but who can't during the current lockdown settings, so we've found alternative things for them to do for patients or practice. For example, proactively phoning patients who are recorded as smokers and offering smoking cessation support. So just using that workforce, work from home, do something different. It's been an impact on our board. We've continued to meet monthly with additional meetings as required via Zoom. We've had to delay strategic planning days. Our quality award dinner we've cancelled again, cancelled it last year, and the AGM will be held virtually this year. And we're looking forward, we're now starting as an organisation saying, gosh, COVID is, the government's given up on this elimination strategy. What's it going to look like with more COVID in the community? How do we support our practices to care for patients who have COVID in the community? Because not everyone goes to hospital. How do you check in daily? When do you need to send people to hospital? How do you do that safely? How do you monitor oxygen and so on? So for example, we bought, I think, 100 pulse oximeters to be able to distribute to practices. So patients might be able to have a pulse oximeter at home and monitor their own oxygen levels at home. So just things like that you can think of as a cooperative. You think of the big picture and look ahead, whereas a practice is still very much, oh gosh, well, how are we going to manage through today? Another thing that I think is challenging all organisations around our country and possibly international is staff vaccination policies. So, we all know we've got to balance the health and safety of our workers and our obligations to keep people safe versus Bill of Rights and people's religious or other beliefs about vaccinations. So, well, for starters, we said, well, let's first of all, let's measure. So we did a poll of our directors, and all of our directors are immunised. So it's great to have leadership from the top. It says, okay, everyone's vaccinated or had their first, about to get their second. And then our directors, who are also GPs, were very proud of saying, well, and all of our staff are vaccinated. So we had that kind of a lead from the top. I think we had a briefing from our CEO at our last board meeting, and we will have conversations and we'll find out among staff. I think they had the first poll, 78% of the staff replied, and it was over 90% were immunised. So that was a great start. You know, there's a few we didn't get an answer back, so we're not confident that we're 90% among our staff. So there'll be some staff who aren't, and we'll have some very respectful conversations with them and just explore their understanding, their beliefs, and their reasons why not. And then we will look to assess those who aren't vaccinated and do an individual assessments of their role and the safety profile of their role. So if they're doing telephone work every day, that's their normal role, well, they have a low chance of catching COVID. So, you know, we don't have to redeploy them or encourage them strongly to get a COVID vaccination. But other staff who are more frontline and interacting with patients, how can we move forward on that? So we will be doing that in a respectful way, in conversation with staff, and not the chairman or the CEO having conversations with them, but, you know, sort of at an appropriate level that they can feel they can have a good conversation.
No, that's great. And I guess thinking to the future, you know, what is ProCare actually doing to future-proof yourself right now, thinking about what might be?
Look, I think there's on the COVID front, I think ProCare will continue to support practices to do the best care for patients. And with COVID, that's about caring for people with COVID. That's about encouraging more and more patients to get vaccinated. And, you know, we're doing everything we can to, that's the big message, isn't it? Vaccinate, vaccinate, vaccinate. That's the way we'll get out. So we'll, of this sort of lockdown setting. And then, of course, in, you know, 2022, I imagine we'll have some sort of opening of the borders, and how do we manage people who come in from other countries, and vaccinations status, and monitoring for ongoing surveillance for COVID as an infection in our community. It's been quite interesting seeing over the weekend people opining about South Island and whether the South Island should have a hard border. I mean, it's much easier to have a border with the South Island versus Waikato versus Auckland. You know, there's all sorts of police stops, but you know, if you have to cross on a ferry or a plane to get to the South Island, maybe they can be have a different setting or stronger rules to not allow people across to reduce the transmission. But eventually we have to, you know, say that the world is open and we want to participate in the world.
If you look at ProCare itself and future-proofing, is there anything in the technology space or anything within the service offerings that you do? And just thinking, like I said before, sort of tongue-in-cheek, but maybe there is something in it about expanding the business outside of Auckland. Are those sort of areas that you're thinking about?
Yes, we've in collaboration with Southern Cross as a partnership, we've created a what we call Care HQ, which is a virtual GP service, and it's run by New Zealand GPs. And you can get 7 a.m. to 7 p.m. 7 days a week. Anybody can go to Care HQ, log in, and have pay for a consult with a GP. That's available to all of New Zealand. And that we don't enrol patients, so that you still enroll with your GP in Invercargill or wherever. But if your GP is not available, but too busy, or it's the weekend or after hours, the service is there to do virtual consults for people. So that's one way that we thought, gosh, the future is changing. Yes, people still value face-to-face time with a GP they know, but there's also those urgent care things, or those repeat prescriptions that you can't get hold of the GP, or mental health. Mental health can be done really well over virtual as well. So there's a whole lot of so that's one sort of future thing we're doing, is to do that. We're also trying to have IT support systems so that patients can have access to their notes online and book appointments online, or do virtual consults with their GPs online. There's a couple of things.
It's great to hear you talk about Southern Cross, because Southern Cross is another member of ours, and that's a really great collaboration, which is one of the principles of the cooperative model. So in terms of that, is there any other collaborations that you'd like to talk about that you're currently undertaking, or potential collaborations?
Look, we are new in this space, and we try and learn off other cooperatives one of our senior directors on the ProCare board is very involved with Co-op New Zealand and sort of giving his wisdom to the board and to the organisation. And we've had other senior directors from other co-ops come and talk to our board about how to run things. So we like to learn off others. And some of the co-op education sessions, for example, the share registry seminar that was run recently, some of our staff went to that, and again, learning from how other cooperatives run, complex things like keeping share registries up to date. And yeah, we're still learning in this space and making those linkages. Yeah, the door is open.
That's great. And I guess I have to say, from my experience, every time I've reached out to any of our senior leaders like yourself, with new entrants coming into the market, there's been such a desire to actually help and work together and collaborate. So it's great to hear you talking about those Rochdale principles about collaboration. So a couple of final questions. One of obviously the challenges around the co-op model is that you've got members, and it's around keeping them engaged. How do you make sure that they're part of the journey? What's ProCare's philosophy on that?
Look, so there's the standard things. We have regular member forums, we have regular emails, we add webinars, and we make our AGM interesting, try and get an interesting speaker, and put some food on and get 100 people along, or more.
Somewhat challenging in a virtual environment.
Yes. But the interesting thing is some of our webinars, in the virtual environment, mean that more people can participate because they don't have to travel across town and find park. They can just log in from their home and participate. It is a bit harder for the back to and from in a virtual setting. This year, before the lockdown, we had aimed that all of our directors would visit all of our practices, and that was good, but then it kind of fell over with different things, as you could imagine. And with the health reforms, when we first got the health and disability system review, we had these huge forums where we had butcher paper on the side of the walls, and we had different members from different practices, not just GPs. It might be the business manager or the head nurse or whoever, and we're workshopping and saying, well, how do we want this future to be? So those forums are really valuable, and when you've got the hot issue, people turn up. We've had forums about how do you transform your business into a more modern one. What about practice management systems, the IT? What's the best thing there? And those forums, when you get the right issue, people turn up.
And it's great that you're actually involving them and finding the solution. I think that's part of it, isn't it? It's about taking them on the journey. So that's what I always hear from people. If you've taken them on the journey, then the shareholders, members will be, they'll buy into what you're trying to achieve and remain. So I guess just thinking forward, what is the main benefit you see? You've probably covered this off already, but what do you see as the main benefit of being a cooperative?
The main benefit is being able to provide benefits to members, not dividends to shareholders. That's the thing we love about being a cooperative, that we're member focused, that we can say, well, look, we can do things at a scale and provide those benefits to individual members that they couldn't do on their own.
So are you classified as a non-distributing cooperative? So you're basically a not-for-profit?
No, we can distribute, but we haven't. We did a distribution last year, a COVID support payment. This year, financials are a bit different, so we haven't done a distribution. But the in-kind benefits of HR support, that's not members can get for free, for example.
No, that's great. And I guess I really love to ask you this question, but left field. So you're a health practitioner yourself. Mm-hmm. I guess everyone's sort of looking at what's going on with government and the decisions being taken. What is your view on how we can get out of this current lockdown situation and get back to business of being New Zealand and opening the borders?
Vaccinate. It's we once we get that vaccination rate up, we can then say open the borders, keep surveillance, do it in a gradual way. That's the way forward. And I just, when I read in the news about different ways that we're doing vaccination clinic centres and different ways of attracting people in, and vans going out to communities and using marae and using sports fields. I just think the innovation of getting the vaccinations out there, overcoming people's fears, and look, that's the way. Then the vaccine passport idea for using internally, I think that's got to happen, but it's not. Everybody should be doing it because they want to vaccinate, not because I can't get this or I can't get that. I want people to want to get their vaccination rate.
Yeah.
You know, we will get there. We, as a country, we had in Australia, they for childhood immunisations, there was a sort of a punitive measure taken against mums or dads who their children weren't immunised when they went to school. I think they withheld a benefit payment. In New Zealand, we never did that, and we still had higher immunisation rates, and that, I think, was about the trusted relationship with their general practice teams and nurses. So I think we'll leverage on that again, sort of a trusted relationships. Yep, okay, look, you know, I was anti-vax, but now I've thought about it some more, and I've talked to, you know, my doctor or my nurse, and so I think we will get a really high rate eventually.
No, it's great, and thanks very much for your insights. So if there's, is there any final words you'd like to share, Harley, with this audience?
Oh, look, I think keep strong in these very challenging times. There'll be opportunities for us to reconfigure our organisations, do things differently and do things better because of the challenges of COVID. And we will get through. And next year, I don't do predictions anymore, but next year's has got to be better.
Fingers crossed. Hey, thanks so much for your time today. Really appreciate you sharing your insights and knowledge. For those of you who are wanting to engage with Cooperative Business New Zealand and the work that we do, please don't hesitate to get in contact. We're here to support you on your journey. And as you can see, cooperatives sit across multiple sectors, so the business model is very valid to lots of different industries and groups. So love to hear from you. And yeah, thanks again, everyone, for joining us, and kia kaha.
Yeah. Kia ora. Thank you.